My name is Gail Schonfeld. I live in East Hampton, and I moved here in the summer of 1982, and I've opened my practice the day I moved here, and I've been here doing the same thing ever since. There's myself, two other physicians, and a nurse practitioner, and we provide primary care to all of the patients in the area. I didn't think too much about it. I knew that there were some warnings that I was to be on the lookout for cases and what to look out for. When I saw my first case, it got a little bit more real for me. I did have a young adult man who I have known since birth, I think, who did travel through Europe and came home with COVID and was moderately ill with it. It was a very anxiety-provoking thing. On the one hand, I wanted to help him and comfort him and give him a big hug. And on the other hand, I was afraid to get too close to him, even be in the same room with him. I knew, the danger to myself and my staff, and really didn't have a lot of information of what I needed to do to help him and to protect myself and the others around me. Within a month, I was seeing infants and newborns as young as 5 days of age with infection, and I couldn't find anything in print or online as to what to expect and how to best care for them. And I hesitated sending them to a hospital because at that time parents could not accompany their infants to the hospital, and leaving a sick child alone in a hospital is a horrible thing to put a child and a parent through. At the same time, I didn't know how safe they were to be at home. I was absolutely treating patients who I knew had COVID. It was really kind of scary. I'm not a young woman, and I knew that I was at risk. This mother called because she and her husband had COVID. It was before the vaccine, and her infant had gotten COVID, and they were very sick. The infant was very sick, and the baby wouldn't stop crying, and she couldn't hold the baby. She was too weak to pick him up, and she wanted me to try and help her, and could I send someone to the home? And I'm sitting there thinking, nobody's going into this household where everybody's infected, and how do I help this woman? What do I say? How do I, make sure that the baby is safe? It was a very upsetting phone call because I really felt like I didn't have anything to offer, and I felt very sorry for her. They all did survive. It was tough, and I watched a lot of parents go through some really very difficult times. They taught me in medical school, half of what you learn is wrong. You just don't know which half it is. And medical school taught me how to learn. It's not what you learn, but how you learn. And you have to find reliable sources, but you also have to read critically and think, well, this may be true, this may not be true, this may be something I should do, but I have to keep in mind that this may not be the right thing, and to be ready to make changes. There were some excellent resources on the internet, and I have to say, between the CDC, the Department of Health, and my own American Academy of Pediatrics, and the specialists who did every other week webinars for us to try and keep us current. And if I had to get up at 5 in the morning to read and to watch webinars, I just did a huge amount of that to try and get competent quickly. We have a very vulnerable Hispanic population that does not have easy access to care, and I'm sorry, whether you care about them or not, and I do, I really truly do, they're going to help spread the disease. Even if you don't think they're worthy, if you don't address that, you're harming yourself. We've learned this with tuberculosis. The Department of Health has always been on top of the homeless and the poor. They are spreaders of tuberculosis. You have to address this, and these people are afraid of the government. They're afraid of the police. They're afraid of large organizations. They want help. They don't have access, and it's very hard to reach them. I am fortunate in that I care for a lot of the children, and they trust me, and I felt it was important that I be there and try and help. Pediatrics is all about prevention and vaccines, and I have lived long enough to see, well, I remember polio, I remember when the vaccine first came out when I was a little girl. I am outstanding at doing spinal taps in infants because bacterial meningitis was really a thing when I was in training, and I watched it disappear when the vaccines to prevent it came out. I know how real this is. I've lived it. The anti-vaccine movement is powerful. They are using this opportunity to spread misinformation and fear. But one thing I think that I've been taught and that I know to be true is that people trust me. My own granddaughter, the day after her birthday, got her first dose when she turned 12. And my son and pregnant daughter-in-law, I vaccinated them. When you tell people that, they know. Well, not to mention myself, I got the vaccine December 23rd. It was the best Christmas gift that I got. And the first night I had a good night's sleep. Well, what happened is a lot of people from Manhattan fled the city to relocate out here because it was safer and so much more comfortable. I mean, if you're going to be pent up inside your home, much better to be in a large home with a yard than in a tiny little apartment with an elevator. And I certainly see their point of view, but this town was not really prepared to deal with that. I had a 40% increase in volume, and I don't know of any business that can accommodate that. And a lot of my staff quit. I think there were several reasons for that, but not everybody really wants to be a hero. As people quit, it was even more stressful for the people left behind, kind of a domino effect, and it was very challenging to keep things going. And I think it's been one of the most challenging times in my career. Well, I think that there's some degree of resiliency that people have, and for a few months people can handle just about anything. But then after a period of time, I think people lose their resiliency, and they get angry, they get depressed, they get selfish, they get hostile, and they really become unable to cope. And it's very frightening to see what happens to the children when this happens to the adults. I think we need to look more towards preparedness for different types of disasters. Hurricane Katrina was one. This one was worse. And I honestly, with international travel the way it is, seriously doubt this is going to be the last pandemic in my career. Well, it's a marathon. We're in this together. And if people resort to selfishness and lose their sense of community, I think it's going to be a much bigger problem for all of us.